Welcome to another episode of Healthcare Connections podcast, powered by Healthcare Compliance Pros. I am your host, Jeremy Winn. Our purpose for this podcast is to introduce you to key topics and experts in the healthcare industry to ensure you have what you need to successfully manage your practice. Please subscribe and follow us on our social media channels to make sure you don't miss any new episodes. If you have recommendations for guests or topics for this podcast, email me at jwin@hcp.md. With that, enjoy this episode of the Healthcare Connections podcast. Hello, and welcome to this episode of the Healthcare Connections podcast. I'm your host, Jeremy Winn, the Director of Sales here at Healthcare Compliance Pros. I'm excited to have one of our own as a guest today. I've got Lara Schiffman with us today. She is the Coding and Auditing Manager here at HCP, and she does so much for our team, and we all turn to her for advice all the time. So this is going to be valuable for you today. So Lara, welcome to the episode.
Thank you.
Yeah, so I'd love for you to, if you don't mind taking a minute, give our listeners more of a background of yourself, your history, where you've been, even prior to HCP, and what you really focus on for our clients.
Okay. So basically, I've grown up in this field. I have worked in billing and coding at some levels for 35 years. I had initially worked for a billing company who ultimately lost their medical billing company due to some merger and acquisitions that had occurred. But when I started with them, they the coding certification was not a thing yet. It was just you either knew the field or you didn't.
Yeah.
And once I started with them, it became the business standard. So that it was at that company that I became certified to be a medical coder and to do auditing at that time. Since then, I've worked for hospital groups, I've worked for insurance companies, and then I came to work for HCP, originally working in acquisition, pre-acquisition auditing. And ultimately now I am the coding manager.
Awesome. And just so everybody knows, when Lara speaks up in our leadership team meeting, we all listen. she knows what she's talking about, and so her word is gold in our eyes. It's the truth of things. So thank you, Lara. Appreciate it. So we're in a new year now, new administration on board. CMS, it seems like they always come up with something. Hey, we're going to focus on this now, and maybe they put some warning out there, but maybe not enough warning sometimes. So, from what you're hearing in the coding and auditing world around CMS, what do you see as the focus for CMS this year in 2025?
CMS for 2025 is going to increase auditing. Part of how they're going to increase auditing is to implement more of an AI-driven editing system from the onset. So they're utilizing what they are calling smart edits to identify real-time risk of potential fraud, waste, or abuse is what they're looking for.
Okay. And so when you say real time, like, is this, I mean, talk more about, expand upon the real time element of that, because that's, I guess, when you talk with AI, that's what that allows for, is to speed things up quicker on their side.
Yes. So as you submit your claims, they are continually editing those claims to identify areas at risk, meaning your billing patterns real time compared to what you're billing for that individual patient. Based off of the running tally of, if you will, of what your claims look like, they will identify claims specific to your billing patterns that they would like to look closer at or reduce payment for until you submit documentation to support otherwise.
Okay. So they're speeding up the process to try and recapture money or pay out less money, which is what they're always trying to do is pay out less money, right, to these providers. So,
That's absolutely true. What they're trying to do, because it's a lot harder. If you think about it from their perspective, it's a business.
hmm
Um, and it's a lot harder to pay out money to somebody and then take it back and get that money back
right.
than if you just reduce the payment to begin with,
Okay. That's
then and make them work to get the money from you.
there you go. So that's the change in strategy is less clawbacks, and they're trying to be more intentional on, well, we're going to pay less up front until you prove that you deserve this. Okay. That's great. No, that's, I mean, when I say great, that's good clarity for our listeners. Hopefully, as that rolls out, obviously the tool balance on the provider side to be ready for it. So in 2024, just with our own clients, as I was out, talking with people at different conferences through the year, one of the specialties that I think was maybe targeted heavily in 2024, at least from what I heard out in the field, was ENT groups. I heard that from a lot of ENT groups that they felt like they were being picked on a little bit last year. Are there certain specialties that still currently are being targeted maybe more than others? Are there some that you foresee coming that these specialties are going to be looked at under a bigger microscope?
All specialties are going to be at risk on a bigger microscope with this process in place. But actually, it started with dermatology. Dermatology clients were seeing a higher level of scrutiny initially, and based off of their findings with dermatology, they then moved into ENT. So, and the reason for that is that dermatology was found to be the specialty with the highest modifier 25s
Okay.
initially. And so they were the first ones targeted. And because they got such good return on that, they
Mhm.
went into the second highest, which is ENT.
Which is ENT. So that modifier 25 that's really been the focus. I guess for those that maybe don't quite understand, what's the reasoning for that modifier? Why was that? Um,
Well, the modifier 25 says it. So if you think about codes as a story, you have your individual story. So your 99213 says that I saw this patient and it was a low level of medical decision making. But when you add the modifier 25, it says to the payer a little bit more. So now you have this level of medical decision making that's low, but it's significantly identifiable,
yeah.
significantly separately and identifiable, sorry, from the procedure that was billed on the same day, the minor procedure that was billed on the same day.
Okay. And so, looking ahead for those that are trying to figure out, okay, I want to prepare myself for CMS increasing their activity and using these new tools. I think it'd be helpful to talk a little bit about, we have a compliance risk analyzer tool that you're really the expert on that you use with our clients, those that are interested. I think it'd be good to talk about that, if you don't mind, that tool and that service and how it can help practices prepare themselves for potential audits, and really just probably to ensure that they're in a pretty good standing on their practices with around coding.
So really the main focus for the compliance risk audit analyzer is that we are looking at a year's worth of data and benchmarking them the same way payers are, identifying risk in 5 different categories. We're looking at their E&M, their non-E&M, their RVUs, their modifiers, and then their total time.
Mhm.
Um, it's beneficial to our clients to know in advance what procedure, what code sets that you're billing that is going to be the ones that are most likely going to be looked at from the payer perspective and or decrease based off of your code sets, your your payment. So I guess slightly backing up, it's important for you to understand that with some of these real-time claims edits, payers are identifying E&M services that they are finding based off of smart edits, which is for them, it's looking at the E&M code and the ICD-10 codes,
Mhm.
um, along with procedures, etc. They're looking at a number of things, all of the things that we're looking for on the compliance risk analyzer. But it's important for you to understand that they are going to take back that money or reduce your payment based off of the code sets that you're billing and their analysis on those things.
Okay. And so when you take somebody through this process, when a client comes to you and says, "All right, I want to run the compliance risk analyzer," you go through that process, help them identify areas of risk, um, and then from there, a natural follow up is chart audits. Talk about how the we call it CRA, compliance risk analyzer, CRA for short. Talk about how that can help streamline the follow up chart audit process as well.
So when we analyze a year's worth of data, we identify those claims that would more likely than not be targeted by the payer. And then we look at the notes to see how your documentation supports the level of service that you're billing. Why that's important is because one of the reasons they are so successful in clawing back and reducing payment on these low levels of service that are billed with modifier 25 is because providers have re, began to rely on the templated language that is populated by their EHR with the push of a button.
Mm-hmm.
All of those things are being negated from the payer perspective. And so if we look at your documentation, we're able to provide you with education on how to document clearly to support your level of medical decision making above and beyond that procedure.
Okay, that's great. That's really helpful advice for our clients. So, I would just interject there and say, so if you're interested, in utilizing this tool with Lara and her team, you can reach out to me directly, and I can get you connected with Lara. My email is jwinn@hcp.md. So those that are listening, if you want to learn more about this, reach out and we can talk about it. But Lara, one more question, just you know, in preparation, I guess, for what you see coming, is there any other additional piece of advice that you would offer up to practices out there?
Yes, I would track your denials closely and track what your expected payment is versus what your payment received payment is, because
Mhm.
some of those are coming through as adjustments, not necessarily um, indicating exactly why it was adjusted to the level it was.
Yeah. Okay. Awesome. Well, Laura, that's what all I got today for this episode. Thank you for providing an update on what you're seeing in the coding and auditing world and from CMS. Sounds like um, lots of education that people need to go research out there and get ready for. um, Appreciate your time today, Laura. We'll probably have you on again here in a couple months as we kind of look back and say, okay, here's the trends we were anticipating, here's what we're continuing to see. I think would be a good follow-up conversation in a few months.
Okay, thank you.
Take care.
Thank you for tuning in to this episode of the Healthcare Connections podcast. For more information on the topic we covered today, you can reach out to me or to our guest. For any additional information on healthcare compliance pros, feel free to email me at jwinn@hcp.md. Don't forget to tune in next week. Thank you.